All right, welcome everyone. We're going to get started here with the stream today. My name is Nick Zupan. I'm the epidemiologist with the Rock County Public Health Department, and we're going to be talking about data today. Thanks for joining. As always, if you have questions, feel free to put those in the comment section below the video, and we'll try to answer any questions that come up during the video. If you have questions after the video has concluded and you're watching the recording, you can always reach out to us via social media with those questions, and we'll try to answer those as quickly as possible. And sometimes we'll even try to answer them on a future video. So today may be a little bit of a shorter video, but I wanted to address one of the changes that you may have seen if you've been following some of our data updates and some of the data updates from the state related to COVID-19 cases. I put kind of this message in this dark gray box has changed over the past couple of weeks, but essentially what happened was on a statewide scale, there was a little bit of a lag in reporting COVID-19 testing results. How we normally get our testing results reported to the health department is through an electronic disease reporting system called the Wisconsin Electronic Disease Surveillance System, also known as WEDS. And so when we have an issue with this system, there can be a backlog of case reporting that needs to happen. And so what we saw a couple weeks ago was that there was very, very low case activity. And then as that issue was resolved, all of the backlog in case activity and positive and negative results kind of started flooding the system as that issue was resolved. And so the result was that after about a week of very low COVID data, then we had another week of very high COVID data for Rock County. The other issues that we were seeing is that there were some reports that had not been entered into the system from some of the agencies that normally report this information, and those had been cleared up too. And so what happened is we have a situation where it looks like, because the official total of COVID-19 cases goes up quite rapidly, it kind of appears as though there's a surge in case activity, when in reality there's just been a kind of a slight increase in our COVID activity, but not kind of the spike that the data makes it look. So I just wanted to talk through some of the case activity data on our daily update today and give you a sense of what numbers were impacted by this issue and what numbers were not impacted by the issue. So when we take a look at this information, I'll provide that additional context, and just kind of the final update is that the system issue was resolved, and moving forward, we shouldn't see ongoing issues in terms of the data reporting or fluctuations based on issues with our electronic disease surveillance system. Any increases or decreases in the next few weeks should be driven solely by case activity and what's going on in the community. If there happens to be another situation where there's some kind of technical glitch, we will try to make that abundantly clear, posting on our Facebook and our daily reports. We also have added some additional information to other reports that were impacted by this lag. And if you do have questions about this or feel like we need additional messaging on these reports or other reports, just feel free to reach out to us via social media or via email. So without further ado, let's just start talking about some of the data that we are reporting. So the official tally, as I mentioned, for the Rock County over the course of the pandemic is this 18,478 number. And that official tally was definitely impacted by this issue and the data lag, where, like I said, for a few days, there was maybe an increase in the single digits. And then all of a sudden, a few days later, there were increases on a daily basis of 100 cases or something like that. And so that is really just a result of the technical glitch, and not necessarily the result of 100 more people testing positive after a really low number of increase in case activity. The other number that is impacted is this CDC reported number of new cases per 100,000 in the last 7 days in Rock County. The CDC acquires their data from the state. And so as the state had this glitch in the system. They were reporting lower numbers than were actually happening. And then after the glitch was resolved, they were reporting kind of all the backlog and the catch-up cases. And so if you've been tracking the CDC numbers, we dropped down for a while, almost, I think, below 100 cases per 100,000 at the beginning or the middle of last week. And now we're up to 247. I think in reality, when we look at the true number of people who are testing positive at this point, it's closer to about 200 new cases per 100,000. And this number will begin to normalize as we get further away from the period of time where the data was impacted by that technical issue. One of the numbers that is not necessarily impacted by the technical issue is the number of active cases. Right now, the true number of active cases is around 737. So we are seeing an increase in active case numbers. So that isn't something that's necessarily impacted by this issue directly, but there are some kind of data variations that could be potentially affected by a data system error. We try to follow up as quickly as possible with all of the positive cases, people who've tested positive in Rock County, to see what their symptoms are like and whether these symptoms have subsided. We have a brief definition of what it means to be recovered. We do take a conservative approach of, if we aren't able to make contact with individuals, there must be 30 days passed from when their illness began for us to consider them recovered if we aren't able to make contact. So if you do test positive, it's really important to communicate with the public health nurse that's making contact with you to make sure we can record that you have recovered from your illness, so we're not over-reporting the number of active cases that are in the community. This definition is provided by the state of Wisconsin Department of Health Services, so this is not something that we're inventing here in Rock County, but we're using state guidance to determine these active case numbers. Another number that is not impacted by the data system error that occurred a couple weeks ago is the hospitalization number. So the hospital numbers are reported directly by the health systems a couple times a week. So we get this data on Tuesdays and Thursdays from each of the 4 health systems in Rock County. So these are the number of patients getting care at one of the 4 Rock County hospitals. There are situations where patients have been transported or gotten care in a healthcare system outside of Rock County. We see some hospitalizations in Dane County among Rock County residents. This graph does not reflect that information. It's solely those who are hospitalized here in Rock County. Most recently, we had 14 patients in the hospital getting care for COVID-19. So this is slightly down from earlier in the week. These numbers, hopefully we continue to see a decline. We've kind of been hovering between 15 and 25 cases in the hospital on any given day over the last few weeks here. We are starting to see a decrease in hospitalized cases, but that number could rapidly increase. We're still seeing a high number of new cases being reported to the health department, and there are still people who are getting severely ill from COVID-19. So again, this number wasn't impacted by that data system error. So you can take a look at this data over time, and that, excuse me, won't be impacted by the data glitch. The other piece of data that I wanted to focus on for today's video is just related to the number of daily new positive results and the 7-day moving average. So you can see most recently, it looks like we're kind of spiking here in terms of our average case activity. But really, when we look at our numbers, the average, including the kind of the data that was added to the system after that backlog of cases, was in the 50s or 60s. And now we're down into the 40s for, excuse me, I'm having a little tickle in my throat. So really, that's kind of all I wanted to share for the stream today. I'm losing my voice, unfortunately, so I'm going to stop there. I'm going to pause and take a look at the chat box to see if there are any questions that have come through, and try to recover my voice to answer any questions if there are any. All right, it looks like no questions. If you do have questions, feel free to reach out to us via social media. And with that, we're going to close out the stream today. If you do have further questions, let us know. And until then, we'll see you in a couple weeks. Thanks, everyone.